Welcome to the Newby Health Perspective with Dr. Newby. This is your go-to source for all things health and wellness with your host, Dr. Newby.
Good afternoon and welcome to the Newby Health Perspective, your go-to source for all things with health and wellness. I'm Dr. Keith Newby, and every week I'll be here to guide you through the latest in the medical world, both past and present, ideas to consider, health tips and perspectives, and expert advice. Today, our discussion is on the world of medicine itself. Why is this type of programming even important? What is being a doctor all about? Why do I personally do what I do? Why is it important for you as a consumer to go to the doctor? And why are we as physicians essential to your overall health? These are questions I plan to answer throughout this broadcast. For my African American brothers and sisters out there, I want to focus on one aspect of health for you. We have a tremendous healthcare disparity in our community related to chronic illnesses to include heart disease and cancer rates. Black Americans have remained at a higher risk for heart disease than whites for the past 20 years, despite a significant reduction in the overall burden of this disease in the general U.S. population. Factors contributing to this disparity include increased rates in our population to include obesity, diabetes, and hypertension. The higher risk in the black population is also driven by social determinants of health, such as low income, environmental issues like where you live, poor access to health care. Understanding how these socioeconomic factors influence cardiovascular risk amongst our community members can guide targeted interventions to eliminate these disparities. Let's now talk about cancer disparities. African Americans have the highest death rate and shortest survival of any racial or ethnic group for most cancers. Black men also have the highest cancer incidence. For example, prostate cancer death rates in black men are more than double those of other racial and ethnic groups. Black women are 40% more likely to die of breast cancer than white women and twice as likely to die if they are younger than 50. About a third of African American women report experiencing racial discrimination during health care visits. Living in segregated communities with a high African American population is associated with increased chances of late-stage cancer diagnoses and lower survival rates for breast and lung cancers. These are issues we need to talk about, discuss, and resolve. These disparities highlight the importance of addressing social determinants of health, improving access to care, and promoting equity in healthcare delivery. Efforts to reduce these disparities are ongoing through research, community partnerships, and targeted interventions, but we could do more. I personally cannot speak representing all physicians, but I can speak for myself. I went into medicine to help people, plain and simple. It may sound altruistic, but it's factual. I came from a background of physicians and educators. My grandfather and grandmother were both educators. Many of my family members teach, taught, or are professors at different institutions of higher learning. My father, the late Dr. James E. Newby Jr., was my idol and my reasoning for going into medicine. His passion was evident in his life's work. He was born and grew up right down the street from this illustrious institution of higher learning and died at the tender young age of 41 from a primary cardiac tumor. That's a very rare form of cancer that in my entire career I have yet to see. I was 7 years old at the time, so there are many things about him that I do not remember, but I do know his legacy still lives on through me. He was many firsts. He was the first African-American physician to be board certified in internal medicine in this area, the first African-American to obtain privileges at the then Norfolk General Hospital where many other African-American physicians could not practice. He was chief of medicine at Norfolk Community Hospital, which at the time was the only hospital many of us as African-Americans could attend and receive treatment. He was also the first African-American appointed to the Norfolk City Planning Commission. So I have quite a legacy to live up to, and that fueled my desire and drive to be the best in the profession that I could be. But of course, like any other situation, I had my challenges as a young person growing up here in Norfolk. Many times I lost my way, was not sure of the outcome I would achieve, but God touched my heart and put me back on track at a very young age. And once I knew what I wanted in life, there was no stopping me. I attended this illustrious institution of Norfolk State University where I majored in biology and minored in music. Now, I won't talk about the year I finished because that's going to tell my age. I'll just say this been a minute ago. I was always passionate about music, jazz, gospel, R&B. In fact, my music background helped me tremendously as a physician, as many heart sounds are rhythmic in nature. This helped me understand medicine even more as I went through my career. I pledged to Omega Psi Phi fraternity while here, and after completion, attended Eastern Virginia Medical School, where I graduated in 1990 and transitioned to Emory University in Atlanta, Georgia, where I completed my internship and residency in internal medicine, and then applied and was accepted to Duke University, where I completed my cardiology training with an emphasis in electrophysiology, which is the study of heart rhythm disturbances. All in all, I spent 17 years learning what I do in my career. I came back to the area where I started to practice medicine. I currently practice cardiology at Bon Secours Mercy Health here on 21st Street in Norfolk. My principal hospital location is Centera Norfolk General. My dedication is to help those in need, support my people and my community through hard work and dedication, and try to educate and understand why healthcare is so important and explain that to people that I have to treat. I wanted to provide you with this background for a couple of quick things to consider. One thing is that I've always found myself challenged to debate with patients about healthcare as they try to tell me about the research they've done and why they choose the things they do for their own health situation. My message back is always as follows. One of the biggest obstacles you have is your thought that you know more than we do in the medical profession. People say to me things like, I know my body. You may know your body, but you don't know medicine. You have no conceptual idea of anatomy and physiology and how the body works. We have spent years educating ourselves through study and lectures on how the body works and how to treat illnesses and chronic conditions. You do know how you feel, and I don't dispute that, but that is all you know. You can never truly know the medical profession and I'm going to just scratch that. I'm going to edit that part out. You do know how you feel, and I don't dispute that, but that's all that you know. You can never truly know unless you went through training, as I have, medicines, how the body works, how you have to interpret clinical conditions that and the like of that sort. And I just cut all that out. I'm going to do that part again. We have spent years educating ourselves through study and lectures on how the body works and how to treat illnesses and chronic conditions. You do know how you feel, and I don't dispute that, but that's all that you know. Without the proper training, you can't apply what you think you know to medicine. Without the ability to understand what you're reading, you may interpret information incorrectly. That is where our level of expertise comes into play. But by in no way is this a dictatorship, but a joint relationship between physician and patient. Your involvement is instrumental in my ability to assist you and hopefully diagnose whatever disease process may be ongoing, and is definitely a mutual relationship. But without the two together, the likelihood of success will be limited. I've seen many people leave this world thinking they knew more about medicine than physicians and have made choices that are not in their best interest. Our ability to help you is what we're here for. Now, on the other hand, there are many bad doctors out there, and I don't dispute that either. But if we're careful explaining to you why we do what we do and our rationale behind our decisions, hopefully that will gain confidence that you know that we are here to serve. Part of our expertise is understanding that many different diagnoses present similarly. As an example, people who experience shortness of breath can have several different diagnoses causing the same symptom. Congestive heart failure, pneumonia, bronchitis, asthma, COPD, interstitial lung disease, to name a few, can cause shortness of breath. Our ability to talk to you, evaluate you based on your history and physical findings, find out nuances of the symptoms you may have may point us to one diagnosis or another, and how to apply information learned from diagnostic tests in order to create a differential diagnosis, and eventually the actual cause of your symptoms is where our level of expertise rings true. You can go on different websites and read all you want, but without the background knowledge of how to apply that information, you may find yourself going down the wrong path, which, if the treatment is delayed too long, could end less than desirable for the patient. Treatment options can vary and may include medications, but may equally, if not more importantly, include a change in lifestyle. Many do not know how to eat, how to live, your level of exercise and activity, and how it may impact the instances of chronic illnesses such as heart disease, obesity, diabetes, and hypertension. I think I want to do that again. Let's start back from that little pause I had. Treatment options can vary and may include medications, but may equally, if not more importantly, include a change in lifestyle. Many do not know that how you eat, how you live, your level of exercise or activity, and how it may impact the incidence of chronic illnesses such as heart disease, obesity, diabetes, and hypertension ring true. Even cancer rates can be affected by lifestyle. Part of our background is understanding the data in the literature and how to apply it to real-life circumstances. They may have been multitudes of studies performed over the years which help guide our hand as to treatments, but having had courses in research, I can interpret that data and based on how it is written, interpret whether it is relevant or not. There have been many studies that have been performed for various reasons and not always in your best interest that may come to a conclusion that supports some treatment that may or may not make somebody richer. My job is to be able to exclude that information and look at that data and find that which is more relevant and true, and then from that come up with a guideline to help you with your best care. Another big challenge we as physicians have is trying to convey to individuals that medications are not always your enemy. Many people will say that they do not need certain things because they exercise daily and eat right. But what does that really mean? Are you exercising the proper way? Are you eating proper foods? Even if you are, there are environmental issues that may impact your health that you may not even be aware of. And unfortunately, you cannot always exercise off chronic illnesses. Let's do that again. And unfortunately, you cannot always exercise off chronic illnesses. Where you live, things in your home that may impact your health, local factories that may be spewing toxic chemicals in the air that you breathe, bad habits that you might have, like smoking, drinking alcohol excessively, smoking marijuana. Yes, smoking that can cause problems. Lack of physical exercise can all impact one's health negatively. I have found that many individuals will not want to take medications, yet they will take 1 million vitamins, eat whatever they want, gain weight, and have every excuse in the world why they do what they do and wonder why things are not going well, then try to blame somebody else for their failure. Accountability is key both as a patient and as a provider. We are here to provide you the information you need, but your job is to listen, follow instructions, live right, and do the things necessary for your long-term health. The treatment may entail medications, lifestyle change only, or a combination of both. One thing I've found interesting is our people are notorious for utilizing potential of side effects of medications as a means of not taking it, when the very first discussion point should be how is this medication designed to help your life. Then the second would be potential side effects that you may have. Just because something is listed as a potential side effect doesn't mean you will experience it. Most side effects occur only in a small percentage of patients, which could be less than 1% or up to 5 to 10% of all who take the medication. Everything must be weighed on a risk-benefit ratio. Now, we talked about some of these other points. Let's talk about monitoring one's progress. Now, that should be done, and only we as physicians know how to do that properly. If a treatment strategy is initiated, the follow-up is important both to ensure the treatment is working and that no new problems have occurred that need to be addressed. There are no absolutes in medicine. Everyone responds differently to medications, but the intent is never to first cause harm. There are many asymptomatic disease processes that without treatment can lead to bad outcomes, and you may feel totally fine until that bad event occurs. Hypertension is one in particularly that is frequently asymptomatic, meaning there are no symptoms associated. A lot of people will think that a headache is the cause of, or I should say that if they develop a headache, that's coming from a hypertension problem. But that's one of those characteristically wrong thoughts. Most people do not know when their blood pressures are elevated, but even a blood pressure of 140/80 can cause significant medical problems. Strokes, heart attacks, kidney failure, heart failure, all can occur. Up to 42% of those with a top number of blood pressure of 140. Now, I've had people tell me, oh, that pressure of 150/90 is good for me. Well, no, it's not good for anybody. If you look at the data, and the data is very clear, those types of blood pressures can lead to these chronic problems occurring, which can lead to some major complications and even death. These are things that you wouldn't know, but we as physicians can help you with. Many patients may tell me that they only take their blood pressure medication when they have a headache, which is unfortunately the absolute wrong thing to do. Headaches are not indicative of an elevated blood pressure, and because of a lack of compliance with taking medications, bad outcomes may often occur. So in other words, if you just take your medicine when you have a headache and your blood pressure is always high, that can lead to these complications I just talked about. And while we're on this subject, let me dispel a quick rumor. We as physicians do not get paid to prescribe drugs. A lot of people may think that, but that was outlawed over 30 years ago. We get no financial incentive to provide a medication. Our job is always to provide that which is best for your health. Doctors do not make the kind of money you think we do, so please don't let insurance companies and drug companies off the hook. They are typically the groups that do the best in terms of financial gain. We are on the front lines working hard to help you, working long hours more than you could ever know. I personally get up every morning at 4:15 a.m. and get home most nights between 8 and 10 p.m. And I'm not out playing golf, contrary to what one might think. I do what I do because I love people and want to help. My Christian beliefs guide my steps in my quest to be of service. And one thing I did want to talk about is preventative care. Absence does not make the heart grow fonder. People often will avoid coming to the doctor and do not receive their proper screenings for illnesses that are preventable, or if early detected can lead to a cure, at least early enough to prevent complications. Once the disease process has developed and progressed, many times it's too late. Screening for cancer, diabetes, cholesterol levels, all can lead to a good outcome if addressed early enough to prevent disease processes from occurring. Without this, there's little that can be done if a person waits till the last minute to come in and get treatment. Visiting your doctor regularly and having these important screenings can help save your life and the life of those you love. And let's talk a little bit about vaccinations. For some reason, that is like a bad word in our community and is an undeserved bad word. Vaccinations have saved many a life. I get somebody to tell me they don't want to take a vaccination because they feel like they don't know what's in it, or it's going to make them grow a third head or an extra arm. And I look at them and say, what about that weed you were smoking? Did you have a problem smoking that? And they would look at me and like, what are you talking about? I said, you go out and buy weed you eat at these fast food restaurants. What's in that? Do you know where that came from? Why are you so quick to make a statement that the vaccination is a problem, yet you could do these other things and it's not? These are dangerous thoughts that I hope people will take heed to and maybe take a step back and say, okay, maybe I need to rethink this. Maybe that vaccination is not as bad as it sounds. I've had 5 or 6 COVID shots. I've lost count. I ain't growing an extra arm. I don't have a third leg. None of that. And why did I do it is because I saw people dying of COVID-19. During the height of the pandemic, that was one of the few disease processes that scared the life out of me, because I knew it was a respiratory process. So that means you could just be in the same room with somebody and you can catch it. And I did not plan on leaving this earth any earlier than the good Lord was ready for me. So I took that vaccine and willingly did it and will continue to do it if I needed to. Again, you have to trust the system to some degree. I hear you. I understand past experiences, but that's why you have to have doctors that you trust to help guide you. Okay, now that I've kind of got off my high horse on that one, let's talk about risk of self-diagnosis and delayed treatments. There are many patients who try to self-diagnose themselves or self-medicate themselves, even taking other patients' medications and utilizing them for themselves. All I can do with that is shake my head. Without understanding the medicine, how could you possibly take another person's medication that doesn't belong to you and on your own do this without having any idea of the potential risks to you? Reading information on the internet, which I would let you know is a totally unregulated source of information, can lead to misery if applied inappropriately. I can get on the internet and say anything I want to say, and there's nobody around to tell me otherwise. So you don't want to have a scenario where you go on the internet, read something, hold it true to heart, and react to that, because what if that information is wrong? What if you make a choice that is going to do you harm, thinking you're doing right because you are reading information you don't know? That would almost be like if you came to me and asked me for financial advice. I mean, I read it just enough to be dangerous, but it doesn't mean I know what I'm talking about. And I wouldn't want you to do anything financial that I advise you to do. That's why they got people out here that know what they're doing, because that's their level of expertise. You ask me a medical question, I'm on it. I can help you all day long. But we all have to understand our levels of expertise and act accordingly. Don't ask Joe Blow down the street or Cousin Fred, who don't know squat, about some healthcare problem. They don't know anything about that. And if you ask them, they'll tell you wrong. And I'll tell everybody gives bad advice. I will say to them, that bad advice you just gave that person, suppose something goes wrong. Would you be willing to take care of that person for the rest of their life because of that bad advice you gave them led to some health outcome? If the answer is no, you don't need to give it. And you may want to ask anybody that tells you don't take some medication. If I stop this and something happens to me, are you willing to take care of me for the rest of my life? Because if the answer is no, back off them fools because they don't know what they're talking about. Now, again, get off this high horse. Let's talk about delayed treatment. As I mentioned earlier, many disease processes such as hypertension, diabetes, cancer, heart disease can be addressed if detected early. The longer one delays treatment, the worse the potential outcome. That's factual and without question. When you delay going to the doctor for whatever reason, you are in fact being selfish in your thinking. Now, we do know that there are situations where, listen, hey, tough financial limitations or transportation limitations may not allow you the ability to get to the doctor's visit or to pay for it. But you seem to find a way to go to the club when you want to go and pay that surcharge. You find a way to go to one of those R&B concerts that may cost $500. You find a way to pay for that weed you're smoking. You find a way to pay for those $500 sneakers or even higher price for those. One thing I know is, and this is true, is you will find a way to do something if you want it bad enough. The problem is we don't value healthcare enough to put that value high on our list. But just remember, if you are married, have a family, or whatever, that family needs you, and by avoiding going to the doctor for evaluation and treatment can potentially lead to a bad outcome. Can potentially lead to a bad outcome, which will cause undue stress on your family. Let's do that again. One thing I know is true, and you will find this. One thing I know is true is you will find a way to pay for something if you want it bad enough. But just remember this. If you are married, have a family, or whatever, your family needs you. By avoiding going to the doctor, what you do is you put yourself in harm's way, which potentially can impact your family. So that means that you go out and have a stroke because you chose not to take that medicine. The potential that that family member would need to take care of you for the rest of your life is relevant or important, I should say. And that issue, let me say that again. If you're married, have a family, whatever, your family needs you. And by avoiding going to the doctor, that puts you at risk for complications that may lead to that family member having to take care of you for the rest of your life. And how do you think that impacts them? If they know that they have to do all this wiping your tail, whatever, feeding you because you can't move because you made a selfish choice in your life. Are you that selfish in your life? Are you really that bad? You need to think about it. Remember this, feeling good does not always equate to being good. If treatment is delayed because you delay evaluation, don't say I didn't warn you during this broadcast. So in closing, go to your doctor, get your evaluations, take your medicine, and follow instructions provided. There's nothing worse than hearing a fat person say all they eat is salads. I hear that crap all the time. You don't have a gland problem or a hereditary problem because you're gaining weight. You probably have an eating problem. You probably eat more than you need, and you need to own up to what you are doing. Having the problem is not the issue. We all could do better as it relates to our weight. I'm not saying that. I'm talking about the excuses you're making for the choices that you make. Let's do that again. Having the problem is not the issue. We all have issues that we could do better. I could lose another 20 pounds. I'm currently out there exercising every day now, cutting back on what I'm eating. That's not the issue. It's owning up to your problems, acknowledging your problems, and then setting forth a plan on how you're going to deal with it. That is really what the issue is. Just be true to yourself. Exercise, eat properly, listen, stay in prayer, and it is amazing what can be done with just those simple things. So that's our program today. I hope you got something out of it, and I helped you see a difference in terms of what we could do together as a unit, meaning me educating you, you taking this information and applying it to your life. Visit our website at www.newbyfoundation.org for more information. And I want you to blog any medical questions that you want answered, and I will answer them on the air. Let me do that again. Blog any medical questions you may want answered. Sorry, let me do this one more time. Blog any medical questions that you want answered on that webpage, and I will answer them on the air. You can also visit our Instagram page and Facebook page for more information. I appreciate you listening today, and I hope that you will kind of join in on us on our conversations the next go round. Sometimes I will have guests with me, sometimes I won't, but I will always be here to give you my very best. So again, this is Dr. Keith Newby. I'm actually here for you. We'll always maintain being here for you. And please tune in. I hope you enjoyed it. See you next week.
Catch the Newby Health Perspective with Dr. Newby every Sunday right here on Hot 91, the soul of VA. We are here.